We'll get started. I like to start these sessions with an acknowledgement of country. We acknowledge the traditional custodians of the land on which we gather today. We pay our respects to their elders, past and present, and recognize their continuing connection to land. I will let everyone know that we do our best effort to make sure all the information and advice we give you in these sessions are backed by the evidence. So we make sure the information we share is accurate, it's reliable. We're not here to substitute any individual treatment advice. I do try to help you out as much as I can. If you have questions that relate to your ongoing self management, I will always direct you to your primary health care provider if it's a little bit out of my scope in which I can answer. But we'll do our best. And like I said just before, I like to leave a lot of time at the end for questions and discussion. So, what we'll do in this session, we're going to go through just a little bit of background on arthritis, but we will look at those layers behind holistic management. We're going to be talking about the disease, physical health and movement, the intersection with nutrition and weight management, that mind body connection, and then ongoing self management and support. And hopefully, what you can walk away with today is a bit more of an understanding about how they all overlap, how they all relate, and what that ripple effect looks like, because there's so much we can be doing to influence that. So, if this is your first time here and first time you're learning about the disease arthritis, I will start with some context. Arthritis is an umbrella term that covers a wide range of conditions, ultimately, that cause joint pain, stiffness, inflammation, and it can reduce mobility and function. So, most of us here would be familiar with osteoarthritis or rheumatoid arthritis. What a lot of us don't realize is how many different types there are. There's well over 100 different arthritic diseases, all with their own characteristics and treatment considerations. And something we often hear people talk about is, oh, arthritis is just a part of getting older. While it's true that arthritis becomes more common as we get older, it's not limited to older adults. It's one of those things that doesn't discriminate. It can affect 1 in 6 Australians, including those young adults and children. Osteoarthritis, we could argue that it is preventable. Sometimes it's not. Rheumatoid arthritis, one of those conditions that's not preventable. And there's a lot of different risk factors, a lot of different causes. So when we're talking about treatments and management, there's no one size fits all. And that's something I'm going to kind of talk a little bit more about. So, what I like people walking away with leaving these webinars is that the idea that you don't have to simply survive with arthritis, you can absolutely thrive with it. And that's what it's about. We're going to explore what that holistic approach to arthritis management looks like. We're going to unpack those layers, look beyond the medications, the surgeries, and talk more to that role of movement, nutrition, emotional well-being. We'll touch on sleep a little bit, and by the end, I want you to really understand how they all work together. So, when we're talking about holism in managing arthritis, we're talking about looking at the whole person, not just the joints, not just the symptoms or the disease activity. We're recognizing how physical health, emotional well being, social connections, even just daily lifestyle choices can all interact with one another to influence pain, stress, function, and overall quality of life. So, a holistic model is now seeping more into our mainstream medical models because it's about focusing on giving people practical, realistic tools that help them take control of their health and their well-being. And it is through movement, nutrition, mindset, and just general supportive routines that create those better long-term outcomes. So when these elements are all aligned, we know that people will experience better energy, better mobility. They have a greater sense of confidence in managing arthritis from day to day. if any of us here, and I'm interested to actually know, you can just feel free to pop it in the chat. Has anyone gone down the rabbit hole and they've gone on social media and you've wandered into the world of holistic healing, or you've looked into what that actually means? Because I have no doubt that you've probably seen that term used in ways that could be a little bit misleading. One of the biggest misconceptions I have to say is that holistic care means replacing medical treatment. And often this is dialed up with some promotion of natural or alternative therapies. In reality, a true holistic approach is what works alongside your mainstream medical care, not instead of it. So it's about integrating the evidence based strategies, bringing together different healthcare professionals, bringing together community programs and personal support networks to empower you to have a better quality of life. So just some quick background on osteoarthritis treatment. The management of arthritis, it typically involves a comprehensive approach. If we were to tailor an ideal plan of management, and we're talking ideally what everyone should be getting in care, principles they should be getting is education about the disease, how you should be managing it yourself, the promotion of physical activity and therapeutic exercise, and weight management. So, in the first tier, you will see education, physical activity, and weight management strongly recommended as a core treatment. It's usually the first line of treatments. But while it could be as simple as exercising more, maybe eating a little bit less, ultimately it depends on how you present. There could be more things you can do to actually tweak that management so it works for you. Maybe your problem isn't about going to be fixed by eating a little bit less. Maybe it's about the muscle weakness, and then maybe you should be focusing more on strengthening those muscles above and below the knee. If you are above a healthy weight, then targeting weight loss with physical activity and better nutrition could have a very powerful effect. Maybe if it's poor mood or sleep that you really struggle with, then targeting CBT could have a very impactful, meaningful effect to your treatment. The second tier of osteoarthritis management is usually driven by that increasing need of symptom relief. So, this is where some people might need a bit more support than others, and it's meant to complement this first tier. So, we're talking about TENS and transelectrical therapy, manual therapy, braces, insoles, walking aids, assistive devices, even pain relief medications like analgesics and anti inflammatory medications fall into this second tier. Again, this is targeting people who need that additional pain relief. But this third line of management is interesting, and it's not to suggest this is an outcome. But for some people, surgery absolutely has its place. We say it has its place for the right person at the right time because it can be effective, but it's important that this decision has been made through that formal decision making process. So you've weighed up risks and benefits, you've ensured that you've tried all the other things, the evidence based non surgical interventions that we're about to delve into. We have lots of evidence that suggests physio is great for everyone. Weight loss interventions can be really good for pain relief. If there's signs of psychological distress, then hopefully that's been addressed because these things can actually have a very meaningful effect for delaying or even entirely preventing the need for a joint replacement surgery. Rheumatoid arthritis is different because it is a chronic autoimmune condition, and it means that it requires that ongoing comprehensive management, much like the other types of inflammatory arthritis, ankylosing spondylitis, psoriatic arthritis, it could be gout. But ideally, with these conditions, everyone should be under that care of a GP, a rheumatologist, or a rheumatology nurse practitioner. And the core of management, it's very similar with the addition of medication. So it does include disease modifying anti rheumatic drugs. It could be methotrexate or biologics. Flare plans are usually very powerful tools. Flares can often be managed with appropriate treatment and support. But these flares are a very normal part of living with an inflammatory type of arthritis and can occur from time to time. So even if the disease is well controlled, they can still occur, which is why having a flare plan is one of those valuable tools. Rather than reacting in a moment, a plan is there to help you respond calmly and confidently. So these are the things I usually work with your healthcare professionals to get right, to make sure it's tailored to you and it works for you. If we go and we apply our holistic lenses now, exercise, you'll come to learn it's not just movement, it's medicine. So, exercise is one of the most powerful tools we have for managing chronic pain, which has repeatedly been validated as a means of helping manage arthritis by valid level 1 and level 2 scientific evidence. What this essentially means is that it combines results from many studies to show consistent benefits. Meta analyses confirm exercise improves pain and function across different arthritis population groups. And then randomized controlled trials, which are your gold standard top tier studies that demonstrate that structured exercise programs reduce pain and improve mobility and mood. So, this is why, if you look across every clinical guideline, and if you're wondering why your doctor will say it over and over again, exercise is consistently at the cornerstone of management. It's backed by that solid evidence. Exercise is essentially a subset of physical activity, but it is planned, structured, and repetitive with a goal of improving or maintaining physical fitness. So, exercise therapy, again, is another subset of physical activity, but has very specific therapeutic benefits that we'll shortly talk about. So, arthritis, as we know, affects how we move, feel, live, causes all the symptoms that I'm sure you understand. But exercise plays that key role in turning that around. It's one of the most effective evidence based tools that we have to improve that quality of life. And it's not just about managing the symptoms or that disease, it's helping the body work better. So it's strengthening the muscles that support and stabilize your joints and improves something that we call neuromuscular control. So if we consider the whole body, it's really important to consider the other facets of what's important to in joint protection. It's the ability of your muscles and nervous system to actually work together to maintain balance, posture, movement control. We know that people with arthritis often have reduced neuromuscular control, and this can feed into the pain cycles. It can exacerbate instability and exacerbate the fatigue. Targeted exercises that focus on balance, limb alignment, coordination are about retraining the systems and helping restore that overall confidence in daily movement. So it's about empowerment. Inflammation, we talk about inflammation quite a bit, but it is one of those key drivers of pain and stiffness in arthritis, especially if in the autoimmune types of arthritis. Regular aerobic exercise, so walking, swimming, cycling, has been shown consistently across the evidence to help reduce systemic inflammation in the body. So it helps regulate immune responses, reduce swelling, help promote circulation, which supports the joint and tissue health, which is important if we're considering prevention of the disease from worsening. It also does things like improve joint flexibility to help make everyday tasks and activities easier, making things more manageable over time. So, weight management, again, is another key role that exercise can play a part of. It plays a crucial role in arthritis care. And just some background on that extra body weight it does increase a lot of pressure on weight-bearing joints like the knees, hips, and spine. Even that small reduction in weight can significantly reduce joint load. If we're reducing the joint load, it can help with decreasing pain, improving function. So, this is why we always talk about exercise in combination with healthy eating. These are the most effective ways to help achieve and maintain healthy weight and help with that arthritis, um, those symptoms. So, with all these benefits that come along, and I could probably go on and on about the benefits that come with exercise, I hope it makes sense as to why exercise is one of those fundamental aspects of holistic care. We get a lot of questions about what type of exercise is going to be the most beneficial. Ultimately, it's about finding what works for you. You might hear physios say this from time and time again in these type of presentations, but both strengthening and low impact exercises, they both play really important roles. Strengthening exercises have more specific roles in helping build those muscles that protect and stabilize your joints. Low impact exercise, walking, swimming, cycling, supports your heart health. It helps with stiffness. It improves endurance without overloading the joints. So there's a lot of things you can do to actually get started, and it starts with deciding what you want to do more of. It's about what you enjoy and what you can realistically fit into your routine. It's about finding a baseline, so starting at a comfortable level, even just at a few minutes, they count. Notice how your body responds, though. It's really important that if you're going to be focusing on yourself as a whole, you're listening and tuning in with your body. Plan your progression, so gradually increase time, intensity, frequency. But it's really important that this is done by the support of an exercise physiologist or a physio. It's important to build those relationships with someone um, to actually get it right. They're going to challenge you and push you in ways that aren't going to aggravate your symptoms or make you worse, but they're going to help you differentiate between good pain and bad pain and work to goals that are going to help with better outcomes. So, flare ups are interesting. You don't want to panic if you do flare up. Some soreness can be normal, but it's really important we know what a flare up is versus what normal muscle workout pain looks like. And that, again, is why it can be really important to work with a physio and work with someone who specializes in exercise. Bonus if they have the background in arthritis management, because some soreness, absolutely, it's going to be normal when you begin, but you do want to make sure you're resting, you're adjusting, you're moving at a pace that suits you. You don't want to be flaring up, which can set you back for weeks or even months. So, again, working with those um, qualified professionals is going to be important here. Making it enjoyable is another thing. So, moving in ways that feel good. Group classes, music, exercising with a friend. There's probably what makes you feel good probably looks different across everyone here, and everyone's got their own ideas of what makes them feel good. But it's important to tune in with that and reflect on that. And then finally, being patient and persistent. Do not give up. Progress takes time, but every bit of movement adds up. How much exercise do we actually need? It's just like medication. So we need certain dosages to actually see those benefits. Some people talk about having a 12-week program that's done at least twice a week. I think that's what a lot of the exercise interventions that are arthritis specific are built around. But it's important that it's not a one off. It does require the ongoing maintenance. And this is where the evidence shows the benefits aligning. So, if the benefits of exercise are going to closely align with regularity, and if your goal is to actually prevent the arthritis from worsening and support a better quality of life, this is where consistent exercise is ultimately key. You'll also hear us say that realistically, any amount of exercise is going to be better than none. Do what you can, start low, and gradually build up over time. And you can't talk about exercise without nutrition. Nutrition and exercise work hand in hand with one another. We usually get asked a lot, is there a special diet we can follow for arthritis? And I hate to be the bearer of bad news. The answer is no. But while there isn't a specific arthritis diet or a magic food, I wish there was, um, eating well can still make a massive difference in how someone feels and how they function with the condition. It can also have a big role in influencing how your disease progresses or if it gets better. So it's really important here that we're considering where the evidence reliably points and the impact it could potentially have on you. So the Mediterranean diet, if you're familiar with this is where it's garnered a lot of attention. The Mediterranean diet is an overall well-rounded diet that's emphasizing on your quality of foods. It's rich in all the vitamins, minerals, and antioxidants that are associated with reducing inflammation, promoting a healthy weight, and providing those nutrients that are essential for joint health. It's one of the most widely studied diets that aren't only supported by observational studies, but randomized controlled trials. Remember how I said they're the top tier gold standard studies? This diet's not only known for its role in reducing inflammatory biomarkers in rheumatoid arthritis, that's where most of the evidence is, but it also has a very and clinically meaningful effect for supporting healthy weight management in osteoarthritis and preventing those comorbidity type of diseases that can follow something like arthritis, like type 2 diabetes, cardiovascular disease, stroke. It all connects essentially. So if we consider the impact of diet and weight and its effect on disease, mechanics play a super important role. Excess load, we know it can affect structural integrity of certain joints, particularly in your knees and hips. That links in with carrying excess weight, but there's also that inflammatory component, which plays a really important role here. We know there are things we can eat in the diet which either increase inflammation or it can calm it down. And then, as you should know now, it can actually feed into things like symptom progression and disease activity. So, in those people who have osteoarthritis, particularly in those load bearing joints like the knees, hips, and ankles and feet, and are also overweight or obese, weight can have a huge impact on that joint load. And I want you to just imagine that every time you take a step, it's about 4 to 5 times higher in joint load than what it would be if you were to fall within a normal healthy weight range. So it's really important to consider that if you do both struggle with weight management and the pain from your arthritis. Usually, as weight increases, we know from the data the load on these joints also increase exponentially. So over time, this can actually start to change the way your joints work. It could change things in the way you walk. It can affect skeletal support. It can lead to degeneration of cartilage and bone. So what I'm saying is that it can make things worse, can reduce stability and increase the risk of pain and injury. But that's just from the mechanical side of things. It can also feed into the inflammatory cycle. So fat tissue actually produces some molecules and things called cytokines, which actually trigger inflammation and can exacerbate the breakdown of cartilage and bone. So for people with inflammatory arthritis, and we're talking rheumatoid arthritis or gout, your diet could either be making the inflammation worse or help calming it down. And this is essentially why having that healthy, nutrient rich diet is more than just food or calories here. It's one of those key foundations that impact not just the body, not just the joints. It can impact things like energy, inflammation, mood, and general quality of life.
Hello, John.
So just make sure everyone's on mute. I'm getting a bit of feedback here. Perfect. So I could essentially go on about the benefits and the evidence behind something like the Mediterranean diet, or even any kind of anti-inflammatory diet, because there are many different variations and iterations of what that looks like. What's important to take away is that it's largely about composition. You'll see that it is dominated by foods like fruits and vegetables and legumes and grains. Um, there's a lot of ways they act in the body, and particularly within the gut microbiome, to help reduce that systemic inflammation and um, whole body inflammation. Fermented foods, yogurt, kefir, traditional cheeses, which offer probiotics. Extra virgin olive oil is very rich in those anti-inflammatory ingredients, something we might call polyphenols, which have very powerful antioxidant properties. When a diet is low in processed food, artificial additives, trans fats, ultimately, this is the best way to kind of get a hold of that systemic inflammation. Fatty acids are going to be essential when we're talking about reducing inflammation. Fatty fish like salmon, sardines, all have ways they work to regulate immune responses, and we have evidence to back that. There is also good reason as to why we talk a lot about increasing the consumption of nuts and seeds and leafy greens. Not only are they good for the gut microbiome, but they're offering key vitamins and minerals that support immune cell function. They offer ingredients that are going to support good bone health. So there are many rules of thumbs you can see listed here, and don't stress if you can't remember all of this or you're taking down all your notes. You'll have access to a copy of this PowerPoint presentation after the webinar, so you'll be able to reflect on what these principles look like if you are interested in implementing this in your own daily life. You'll see things that we consistently talk about with the Mediterranean diet. We talk about using extra virgin olive oil as a main added fat, uh, uh, aiming to have veggies in every meal, using herbs and spices. You might see that in replacement of sauces and processed flavorings or marinades. Trying to eat legumes twice a week, fish and seafood twice a week, swapping for whole grain sourdough breads. There's a lot of emphasis on fresh fruit every day, including fermented dairy products, and then nuts and seeds. So that's just a little bit of context on exercise and nutrition. And like I said, I could probably go on about the evidence that back these methods, but we have done webinars previously on these topics in a lot of detail. So if you are interested on revisiting the evidence behind the Mediterranean diet, what that looks like, how it helps arthritis. Same goes for exercise. I'm more than happy to link those webinars in the email that follows this session, so you can go back and revisit those. The link between the body, mind, and chronic pain in the context of arthritis is very strong and well documented. I always say that arthritis isn't just a physical condition, it's a biopsychosocial experience, meaning biological, psychological, and social factors all play a role in how pain is felt and managed. So I always get everyone to kind of take a minute to reflect and think about if you've ever noticed what happens to your joints or what happens to your body when you are stressed, when you haven't had good sleep, when you're feeling a bit more anxious or depressed, and how that relates or coincides with one another. There are a lot of different factors that relate to one's nervous system and how sensitive they are to pain and painful stimuli. So, for people who have more sensitive nervous systems, they also tend to have higher pain intensity. And in terms of pain patterns, they're more likely to have a mix of chronic and intermittent patterns of pain. So, in those who are more stressed or more anxious or depressed, not only do we see them consistently in the research report more intense pain, but they also report experiencing it for longer durations as well. So, what this tells us is that when the nervous systems are dysregulated or they're sensitized, it's usually because we see a detriment to the well being somewhere. This is why some people who have more challenges with mood and sleep hygiene, stress, or any other coexisting conditions, so type 2 diabetes, heart disease, we also see them experiencing more devastating impacts of pain on quality of life. So, what's important to know here is that it's not just neurobiology, but there is absolutely a psychological and social component to pain, which is why we always talk about ongoing management for arthritis. We're really dialing up that importance of addressing mental health support, sleep hygiene, and mindfulness techniques. If you're interested in a little bit more background on that and, well, how do these things work? Just some context. The HPA axis, something we've spoken about before in previous webinars, stands for the hypothalamic pituitary adrenal axis. This is a major part of the body's stress response system. Just picture it as a communication pathway between your brain, the adrenal glands, which ultimately control the release of stress hormones. If you've heard of cortisol, it does get a bad rap, but essentially it's a hormone that helps the body respond to stress. Whenever the body perceives stress, could be emotional, mental, physical pain, that HPA axis kicks in. And as we know, stress can be triggered by many, many things, usually unsettling circumstances, and absolutely having a disease like arthritis. But I bring it up because cortisol, though it's a hormone that's meant to be good and help the body respond to stress, if it's chronically and constantly activated, this is when it can worsen the chronic pain in your body, and it can contribute to that disease progression. It's known to increase things like inflammation, disrupt sleep, lower pain tolerance, and also feed into cycles of fatigue, depression, and immune dysregulation. I always talk about this because when we understand how this system works, we start to see the importance of those mind body tools, and we start to recognize they aren't just extras. They're not just things we yap on about. They're actually very powerful ways to support your health from the inside out. If chronic activation is part of the problem, it shifts that conversation from having the idea that managing pain only works with medication. Mindfulness, breath work, sleep hygiene, relaxation techniques, even just positive mental health habits like um, reading affirmations. We have my lovely colleague in the office, she reads an affirmation every morning. But there's actually so much science behind these, and um, lots of data to suggest how they're more powerful than we think, especially if it comes to breaking up that pain stress cycle. So, pretty much, mindfulness is something we talk about a lot, and there's different ways we can implement this: mindfulness based stress reduction and mindfulness based cognitive therapy. They're very similar and share similar features in how we implement it exactly, but both are structured, evidence based mindfulness programs. They have very similar foundations, but MBSR encompasses a variety of mindfulness practices to help specifically reduce stress, anxiety, and support that overall well-being, where MBCT builds on this model, but it's incorporating more scientific principles of cognitive behavioral therapy, which is usually led by a trained psychologist. It's a lot more clinically focused, but it's very effective for helping manage depression, anxiety, and challenge those unhelpful thinking patterns. We have a lot of studies that show that regular mindfulness practice not only lowers those cortisol levels I mentioned, but it can promote better immune balance, reduced inflammation, reducing chronic stress at that neuroendocrine level. Not only helps with just the arthritis symptoms, but it can help with things like mood and energy levels, which are relevant if you struggle with arthritis or something like fibromyalgia. And again, I could talk a lot about the studies and the evidence behind this, but we have done this in previous webinars, and I'm also happy to link you guys to that. It's essentially why we went on to develop our Relax and Restore program, if you've come across that. Um, Quickly, with rheumatoid arthritis, we had a 2021 study that looked at over 500 people. The overall find results was so interesting. It's because they found that people who had anxiety and depression weren't necessarily the ones with the most joint inflammation, but they were the most likely the ones to report more high levels of pain, more physical disability, poorer self-rated health, and lower quality of life. That was really interesting. It tells us that psychological well-being plays such a big role in how you can manage um, not just osteoarthritis, but chronic autoimmune conditions like rheumatoid arthritis. So these emotional mental health challenges can amplify pain and make day-to-day life feel even harder, even if the disease activity is under control. So this is where we see opportunity to talk more about the importance of counseling and stress management, and even just social connection and simple lifestyle changes. And sleep goes hand in hand with that mind body connection. I would say and argue that it is one of those most underrated pillars in holistic arthritis care. It's not just rest, but sleep can absolutely affect pain, inflammation, mood, and just general functioning. You might be able to relate to that if you do struggle with your sleeping patterns yourself. But people with arthritis are more likely to experience insomnia, excessive daytime sleepiness, or shortened sleep. And this is due to joint pain. So I would say it's like a catch-22 situation where the disease makes it hard to sleep, but poor sleeping can absolutely make the disease harder to deal with and those symptoms. Studies actually show that up to 80% of people with rheumatoid arthritis have sleeping difficulties. Um, People with knee or hip osteoarthritis are 3 times more likely to have sleep problems. But it's when you have poor sleep that its knock-on effects impact every aspect of your well-being. Physiologically, the nervous system can become more sensitive. It means the same joint tissue that is affected can feel more painful, and it's simply because the body is tired. For many people with arthritis, bad sleep, it can lead to worse pain the next day. And it has a ripple effect because this means it could reduce energy for your exercise. It can make healthy eating a little bit harder. Who's ever been so sleep deprived and your diet or healthy eating has just gone out the window because you're trying to find those sugary sweet treats to get you through? As we know, less activity, it does contribute to the stiffness, the joint deconditioning, the poor nutrition, um, which can subsequently and indirectly lead to weight gain. If we're experiencing weight gain, it can increase those joint loads in the knees. Sleep is, I would say, one of the most modifiable aspects of holistic care. Unlike those structural joint changes, sleep can actually be improved with routine, sleep hygiene, pain management before bed, relaxation strategies, mind body techniques, addressing mood or stress, treating sleep disorders. And it's just those small changes that could make a big difference. And if you do struggle, talking to your GP about it is absolutely the best start. So you can absolutely tell your GP that you are struggling with sleep, and they'll be able to point you in the right direction and find a strategy that works for you to help you get better rest. So just before I take questions, I'll finish up with just, I hope by now you can kind of see how all these facets of self management intersect. But alongside the exercise, nutrition, the mind body connection, which takes regular practice, it takes, um, you know, a while before we can start seeing the true effects of those. It's important to consider the practical day to day symptom relief that's needed for actually living with a condition like arthritis. So, topical treatments like NSAIDs or capsaicin can provide that targeted pain relief, while heat and cold therapies can offer comfort in different ways. Knowing when to use heat versus cold can make a huge difference. So, using heat when your joints feel stiff, tense, or achy, or when you loosen up before activity, um, can make a huge impact. Examples of doing this could include warm showers or baths, heat packs. Now you can go to the chemist or pharmacy and just get those adhesive heat packs. Using cold when there's swelling, redness, or a flare up. If the pain is sharp, throbbing, of course you want to speak to your doctor, but if it's after an activity and it's triggered some kind of inflammation, then using that cold could offer that little bit of relief to get you through the drive home or get you out of bed or get you off the couch. It's finding these strategies that work for you at the right time. Alternating heat and cold is very effective. But again, those mind body strategies like mindfulness, cognitive behavioral therapies, lifestyle adjustments, it essentially arthritis diagnosis, it's not a life sentence. With the right combination of treatments, tailoring your self management to your needs and what works for you, it can absolutely make a big difference to how you live with this condition. And so, as you can see, a holistic model is by far from a one stop shop. It's very layered, it's multidimensional, but it does bring together movement, nutrition, emotional well being, social support, and medical care. And it's about recognizing each pillar is absolutely strengthens the others. So there are ripple effects. So small sustainable lifestyle changes can absolutely help with reducing pain, improving mobility, building confidence, and support the longer term well-being. So this approach to self-management, it's meant to be about empowerment, not by any means perfection. So hopefully you have some tools up your sleeve, some knowledge up your sleeve to help take control of your health and live better with this disease. So, as I said, I like to open the floor to discussion and get lots of questions from you guys. And I like it to be a safe space. So, I'll pause the recording so I can just